Congratulations on choosing Carolina Orthopedics for your surgical needs. We strive to provide you with the safest, best surgical experience possible. Everyone has a unique medical history, and thus your surgical plan should be too. At Carolina Orthopedics, we provide you with a personalized surgical plan based on your specific needs and goals. My name is Mason Hicks. As the lead surgical physician assistant for Carolina Orthopedics, my goal is to provide you with the educational tools you need to prepare for your upcoming surgery, as well as guide you through the surgical process, manage your medical care after surgery, and follow your progress until you are active again. With that said, there are many moving parts that have to fit together like a puzzle before a safe and effective surgery can be performed. Our team at Carolina Orthopedics is working very hard behind the scenes to make sure that your surgical experience is an excellent one. This means that we'll be coordinating your care with several entities: anesthesiology, your insurance company, even your primary care doctor. And in some cases, we'll ask you to see specialty doctors like a heart physician, a kidney doctor, or an oncology specialist. This process takes time and patience. We greatly appreciate your understanding as we work together to make this process as smooth as possible. If changes are required prior to your surgery, we want you to know that we at Carolina Orthopedics are requesting these changes based on your health and safety in mind. In order to have an individualized care plan, I'd like you to fill out our medical history questionnaire as straightforward as possible. Keep in mind, we're doing this for your safety. To do this, we need the most accurate medication list, including changes you may have made with your primary care provider before surgery. Specifically, if you have any medical conditions, including current skin infections or history of MRSA, please notify us immediately, as this could change your care plan. Things like acute illness, which you can't predict, such as fever, rashes, cough, chest pain, or changes in your normal health are important to us. More specifically, if you have a history of cardiac disease, renal or kidney disease, or diabetes, there's important things that you need to know before your surgery. To individualize your care plan, please see online materials or refer to your preoperative packet for directions specifically related to your disease process. Additionally, if you suffer from rheumatoid arthritis and use medications such as methotrexate, Humira, or other rheumatoid medications, it's important that you let us know. Just ask us when you should stop these medications prior to your surgery. And last, if you've had blood clots prior in your legs or your lungs around the time of surgery or not, this could change your medication plan, so please let us know as soon as possible. One of the largest concerns around the time of surgery is pain, and we understand this. At Carolina Orthopedics, we want to ensure that you have proper pain management after your surgery. I'd like to ask you to fill out our pain survey while you're in the office or online. Please be as specific as possible. It helps me to manage your pain accordingly. Let's talk about your diet before and after surgery. It's really important to stick with your exercise routine before surgery. Continue to eat healthy, as this will speed your recovery time in most cases. Remember, this is your body, so please take care of it. One of the biggest things that you can do is boost your protein levels before surgery, as this will decrease your risk of complications, speed your wound healing, and decrease your risk of infections. To do this, eat plenty of foods such as chicken, eggs, cheese, and yogurt. But if you don't have a healthy appetite for lots of foods, drink a protein shake or two a day. You can find these at your local grocery store or pharmacy. In addition, you can find facts about the top 10 protein foods in your preoperative packet or online. If you use tobacco, I understand, it's difficult to quit. Use this as an excuse to quit. Tobacco severely impedes your ability to heal wounds and increases your infection rate. Please ask us and we'll refer you to a primary care provider or to other resources to quit. If you like to have a glass of wine before dinner or a beer after the game with the guys, I understand. Please use alcohol in moderation. But within 2 weeks of surgery, I'd ask you to abstain completely. This tells us a lot about your surgery, but also prepares your body for a big surgery. Some of the medications that you'll be using around the time of surgery compete for the same places that alcohol does. That means after surgery, less complications if you can abstain from alcohol for 2 weeks before. When you're ready after surgery to have another glass of wine or beer, I'll let you know when that time is. In addition, it's very important before surgery to follow all medication regimens per your primary care provider and Carolina Orthopedic staff. We have requested that you will use iron supplements before surgery. These are twice a day and will ensure that you have adequate energy and oxygen after surgery. Iron is vitally important to producing hemoglobin, which carries oxygen in your body. In addition, we'll request that you use a multivitamin before surgery. This can be age appropriate, something like a Centrum Silver or a prenatal vitamin, depending on your individual needs. If you've experienced nausea or vomiting with prior surgeries, which is common, we'd like to try and eliminate that by prescribing for you what's called a scopolamine patch. This patch is traditionally used for seasickness but works very well for surgery if used appropriately. 24 hours before surgery, I'd like you to apply the patch to the soft skin behind either ear. This medication, when well hydrated, will essentially eliminate or limit nausea and vomiting after surgery. If you happen to forget 24 hours before surgery, apply it as soon as you remember. We'll change this patch in the hospital. In addition, I'd like for you to ask your primary care provider about the use of immunizations to limit infection control after surgery. There's 4 important ones I'd like you to ask about. Pneumococcal, which prevents pneumonia. Shingles vaccination, which is age appropriate. A tetanus shot, which most patients have forgotten about. It's good for 10 years, so ask your primary care provider about this. And lastly, a seasonal flu vaccine. Depending on the time of when your surgery is in the year, seasonal flu is an important factor in your surgery. I'd like for you to get this unless it's within 2 weeks of surgery, where I'd like for you to hold off and we'll do it after surgery. Before you go, I'd like you to know that I appreciate you choosing Carolina Orthopedics for your surgical needs. We know that you could choose to go anywhere, but at Carolina Orthopedics, we will treat you like an individual and make sure that you get the results that you desire. I look forward to seeing you on the day of surgery, and please call us if you have any questions or concerns before surgery. God bless.